what is flipped class? Before we talk about what the flipped class is and how do we flip a class, the objectives of the presentation, which is something which I learned from my ophthalmology foundation team, is the objectives of for any presentation. So three straightforward objectives. First, let's define what is a flipped class. Number two, let's describe the three levels of a flipped class. And number three is going to be, we're going to develop a very simple plan to conduct a flipped classroom immediately for our postgraduates or for our ophthalmic personnel. So flipped class, as the name implies, it's going to be the reverse of a traditional class. So in a traditional class, what happens is that we have a lecture, we have a doctor, a teacher who is coming on to take the class for the students. And what then happens is that the students go back home and they do their homework. I think, or presumably they do their homework. That's the traditional classroom which we have all been taught over the years, right from our school days. What is flipped class? It's just the opposite of it, where we give the resources, we share the materials to the students beforehand. So students read, prepare for the lecture, and they come to the class. So in the class, what we are doing, we're just making them to apply their knowledge in the classroom in the form of activities or what we call as classwork. So homework and classwork, it's very nostalgic for us, right? I remember our school days are filled with homeworks and classworks. Speaking of nostalgia, you might remember this particular chocolate from Cadbury's called as Ulta Puck. I wonder why Cadbury's buried this chocolate. This is an interesting chocolate where you have the wafer outside and filled with chocolate inside. So flipped class is essentially an ulta class. Ulta means reverse or opposite. We're just going to turn the tables, reverse the roles. So what's happening before the class? The students are learning, and during the class, they're applying what they have learned. And after the class, they are creating something new out of their learned and applied experiences. So there are essentially three levels happening. That's level one. What is happening before the class is that their brains are getting primed with the content. In level two, in the class, they participate. And level three, after the class, they produce. So prime, participate, and production of content, of knowledge. So let's go level by level, one by one. So first level is going to be what's going to happen before the class. Probably the easiest from the teacher's perspective is sharing the resources. We know that we just tell them what to read, what not to read. But even though it's the easiest from the teacher's perspective, it's the most important level in my opinion, because it's important for us to share the relevant resources, relevant materials which are pertaining to the topic of discussion. This one example. The best resource to offer is a video which you can create. So fortunately, I have these videos for my students on YouTube channel. So I try to pick those topics which I have already had a video back. So I share the videos before the class. So the students get adequate time to learn, to read about, and they watch the lecture. So they get a bit of a brief knowledge of what the class is all about. I used to share these 48-minute videos, but I realized that nobody watches that. So I was very disappointed. Then I tried to make these short videos. This is not very short, but this is a simple video which I talks about ocular embryology in just 8 minutes. So now I've made a commitment that I'm teaching you, I'm giving you a resource which is just 8 minutes long. So you can easily find your 8 minutes in your busy schedule. So they watch these 8 minutes, and when they come to the class, they're much more prepared or they're much more primed. Okay? So this is one of the videos which I made for my students. Okay, now what we know is that there are three important components or three layers as far as embryology is concerned, which anybody knows. There is an ectoderm, there is endoderm, there is a middle mesoderm. So you might get the picture, what it is about. So I've started with the general embryology and I'm progressing through the end of the ocular embryology. This is just a synopsis of a discussion, what's going to happen in the class, right? You don't have to do what I'm doing. I'm trying to draw it on a smart board. I'm trying to record it. I'm doing a lot of extra work. But the easiest is you can open up your PowerPoint presentation, what you have prepared, right? And open up the presentation and you can screen record it as you are narrating the presentation. Or simply put, you can open up your Zoom and you can share the screen, open up the PowerPoint, use an external mic like what I'm using, a headphones, and record it. When you're going to record the screen or record the Zoom with your audio and with your slideshow, now we have got a very interesting, very useful flipped class material. And we can share that flipped class video to the students beforehand, maybe a week or so. So what happens now? The students have adequate time to prepare and read for the class. So they have a good material. They have a video which is based on the lecture, what you're going to take for the students. And they come to the class very well prepared. Even if you don't have the time to prepare for such a video, because I know most of us prepare our PowerPoint slides the night before our presentation. I'm guilty of that also. So what we can do is, if we can prepare the PowerPoint at least some time back, a couple of days back, and if we can convert the PowerPoint into a PDF, and if you can share that PDF to our students, I think that's going to be a brilliant idea again. You don't have to be a video. Video is the best way of giving us a flipped resource. So you just share the PowerPoint as a PDF and share with your students. I think that's going to be much easier for the students to go back and read. This is an interesting example. We had one of the classes, flip class on amblyopia. So we shared all the DOS articles. I think most of us are familiar with this DOS, Daily Optical Society article, which are very famous amongst postgraduates, which we can get it online. And still, many students are going to religiously transfer that DOS article bank to the next generation of residents. And you can see here in this, we shared a list of or number of documents for the students, and look at the variety of the documents we shared. There's one document which is a study. There's one document which just had the Q&A, and there's one document which has just the algorithm or a mind map of the amblyopia. So a variety of topics, variety of materials sharing with the students before the class. Now, what happens is that students now are very happy that they have received a good set of materials which they use it for the future reference as well. And also, there are different learners. Some of them don't want to spend time reading or watching a 40 minutes video. Some of them like to watch videos. Some of them like to read articles. Some of them like to just read a one-page article. So we all come in different shapes and sizes. Teachers have to understand that students have different styles of learning something. And it's important for us to understand and appreciate and be empathetic of that fact. So that's to do with the level 1, where we share the materials beforehand. In level 2, we are allowing the students to participate in the class. That's the most challenging, because that's very tricky. What most of us end up doing is we take the class again. We are going to show the PowerPoint slide and we're going to take the class, right? It's going to be again back to square one. It's okay. I'm not saying it's wrong. To begin with, let's flip one by one. First time, when you're starting with this flip class model, I would recommend to share the resources. And during the class, for your comfort, you can just take your normal PowerPoint presentation. And in upcoming class, try to make it more interactive. And how we can do that? Multiple ways. Please go crazy with this. Creativity, sky is the limit when it comes to make the students participate in the class. So what we have tried to do is, just a basic overview is that the whole point of this flip class is the students are now becoming the teachers. The students are going to be the speakers. And the teacher, the tutor, is going to be a facilitator or just a moderator. So an example would be to split the students into multiple teams, give them each one of them a problem, a case, and let them discuss and let them come up with a solution or an answer for each problem and let them present to the class. Now, what's happening here? The students are brainstorming. They're trying to apply the theory, what they have learned, into a real case-based or a problem-based scenario. And when each one of them or the chosen ones are going to present something, now they're going to communicate well to the audience, and communication is very important. One of the biggest reasons why students, especially from India, they struggle a bit more in the Viva examination because they don't really have the practice of talking or communicating. And flipped classroom facilitates that. This is one example where we brought out some problem-based learning, some case-based scenarios. And we had these debates. So we split the groups into two groups. One group talked for a particular treatment in amblyopia. The other talked about against that. So we had different treatment options. So if the topic facilitates a debate, please use that. Now, this is one of the classes where on thyroid eye disease, we shared an MCQ before the start of this class. We asked the students to answer these MCQs. Of course, we didn't give these answers. And we discussed these MCQs one by one. Now, this is a very interesting, it's like a quiz. Also, it's kind of like putting a study there. You are giving a pre and a post lecture MCQ. So it's a great idea for research into medical education. At Movefields, what we do is we share these materials to our medical students, and medical students go through these materials before coming to the class. And by the end of this week, I'm going to use the same template to discuss, to review, and reflect what they have learned through problem-based. So what we can do is just a couple of books. These two books are very famous amongst those who are prepared and those who have excelled in their fellowship exams. It's FICO, FRC of that. Aarti Heda would be knowing about these books as well. We can use these books as templates. We can get these MCQs and we can give these MCQs before the start of the class. Now, students will understand that, okay, these MCQs are from a book which they will read in the future or they would have read in the back of, in the past. But anyways, these books are going to be very high yielding books for them. So we are giving something, we are using resources which are very relevant. This is a fantastic book. This is a fantastic book to get case-based reviews called Case Reviews in Ophthalmology. So we got plethora of resources, plethora of ways where we can make use of participation in the class. What's happening after the class? Now, this is going to be more philosophical or more broader view of it. Simply put, what I do is after a class, I ask the students to take a question from their question bank of their DNB or MS question bank and make a set of notes. Use their textbooks and write it. Now, what's happening here is now they have their own set of notes. This is called as owning your learning. When the students are going to create their own learning material from the knowledge what they have gained and from their application in the class, and now they are creating their own material, which really gives and consolidates their knowledge. And not just that, this is also going to facilitate more thought process, which are being provoked. One thing which I could have done, looking back in the backside, is that during that amblyopia class, I could have asked my students to go to the iPad and open up the various and look for various amblyopia applications which are on the App Store and look at each app. Now, what I'm doing, I'm utilizing the power of the next generation. I'm trying to tap in the technology inside the youngsters. That's how we teachers have to make use of them, not the other way around. Optimize them. Maybe you can even try to bring an application in amblyopia from your institute. So when we tap them and we use them in the right way, we get the best, not just for them, also for our institute and for our patients as well. So essentially, what we are doing is, again, coming back to this. Before the class, they're learning. During the class, they're applying. And after the class, they are creating something novel. It can be some research question, that can be an innovation. No matter what it is important for us to follow up and make sure the students are making the most out of the flipped class. So what are the advantages? Three things. Number one, we are making them better communicators because they are participating in the class. They're opening up their mouths and they're talking. That's the skill. That's a skill to develop. Even for the patients, even for the teachers, anywhere in the world, communication is the most important skill, the most precious soft skill ever. And it makes them engaging. It kind of removes the boring lectures and it creates much more fun, interactive, a gamification or a game-like way of learning something. And it makes them accountable. When a teacher is doing so much effort in creating these resources and making all these plans, they respect that. They do reciprocate it also. So my suggestion, my advice to the early teachers who are taking up this flipped classroom is flip one level at a time. So first, let's share the resources and then take the normal class. In upcoming classes, try to introduce the elements one by one. So that makes it much more easier for the students and for you as well. So I'm going to end here and thank you so much for your patient listening. I hope I've given or shared some interesting insights into flipped class. I would welcome more thoughts from the expert panel group as well. Thanks again. Take care.
Fabulous lecture, Pranesh. I really want to be a student all over again. Maybe your student. I know I started off at the era before PowerPoint. So these are very exciting times for both students and for educators. I have a quick question for you before I have a couple of more questions for Eduardo. And and then it'll be time to wrap up the session. Now, in the Aravind system, for example, or in the Moorfield system, I know there is a lot of hard work to implement a flipped classroom. There is a lot of work for the educator as well. So how successful is this? How easily do people buy in?
Great question, ma'am. Actually, the biggest problem with flipped class is that the students have to prepare for the flipped class. When they don't do that, it's all going for waste. There is no point of flipped class. Actually, it's going to be all over again. that's going to be where we have to be very sure that we are giving the materials in the right way, the right amount, not overwhelm them, but just give them the right amount, give them in multiple varieties, big, small, shortest. So it's like YouTube videos, like give a big one, a micro learning modules, a nano learning, like shorts, just under a minute. That's what I do at Movies. I'm trying to give one resource. For example, I'm going to take an acute angle closure glaucoma, an important topic for undergraduates as well as postgraduates. I'm doing that into a 40-minute videos. I'm doing that into an 8-minute videos. I'm doing that in a 1-minute video. I'm sharing all these three along with the PDF of my notes to them beforehand. Now I've given them all. Now the ball is in their court. And at very first, it might be difficult, but when the students understand that they are being given the best material, they are being given the best teaching experience, then they realize that and they reciprocate it. At some point, it will happen.
Thank you. I know Eduardo has done a lot of work in the area of flipped classroom. Would you like to add a comment, Eduardo?
Yes, thank you. Well, first, congratulations, Pranesh. It was a very good presentation on flipped classroom. I want to comment on two things. Pranesh mentioned some students are prepared. He also said that he first starts with going through multiple choice questions. What I suggest is that this is not done with just that residents stands up and answer them. I recommend using an answering system where you collect what each resident answers, and they cannot see what the others have done. This will give you an idea on how much the residents have studied or prepared for this. Make them just knowledge questions, because the application will come during the exercise. So just make knowledge questions, because if they do not have the knowledge, they will not be able to apply it to discuss the cases. And the other thing regarding work for teachers, but since I started testing this, it made my work much easier, because I just had to have the cases for application. I didn't have to prepare the lectures. And in the web, there are many lectures that are much better than the ones I can. And the last thing I want to comment is that it's good initially when you start, and especially with first year residents, you give them, look at this, look at that. But then you must prepare them for what will be their continual medical education after they leave their residence. Because then they will not be confronted with cases, they will be confronted with patients. And many times they will not have the answer. And they must be prepared to go and look for that information. So another way to add to this is give your residents the clear objectives of what they will have to solve during their active, and give them nothing. Get your best. So they have to go and look for the information and be able to solve the cases with. It's also important afterwards to discuss where everybody went to, what did they look at, and then discuss this kind of searching for knowledge when you are confronted with a real case in real life.
Thank you, Eduardo.